If you think masturbation is always harmless, listen closely, because I see men every week who unknowingly trained their bodies into erectile dysfunction, and it didn't start in the bedroom. Let me ask you something important before we go any further. Have you ever wondered whether your private habits might be quietly affecting your erections or confidence? Tell me in the comments, because this conversation matters more than most men realize. I want you to hear this clearly, right from the start. Masturbation itself is not the enemy, and I'm not here to shame you. What causes problems are how often, and why it's done. And that's what I want to walk you through today, with honesty and respect. I've worked with men of all ages who felt confused, embarrassed, or even broken when erections became weaker or unreliable. Many of them were healthy, active, and doing everything right, yet something was still off. When we talked openly, patterns began to appear. What I'm sharing today is education, not a diagnosis, and it's based on what we understand about the brain, blood flow, hormones, and behavior. If you recognize yourself in any of this, it doesn't mean something is wrong with you. It means your body is responding to training, and training can be changed. Let's start with the first mistake, because it's the most common and the least talked about. Many men unintentionally train their arousal to speed rather than sensation. Fast, rushed stimulation teaches your nervous system to expect instant response. Over time, your brain learns that arousal equals urgency instead of connection. When real intimacy requires patience, presence, and gradual buildup, the body hesitates. That hesitation can show up as weaker erections or difficulty maintaining them. I've had men tell me, "Doctor, my body just doesn't respond like it used to." When we slow things down during conversation, they realize their habits were conditioning their response. The fix here isn't stopping, it's retraining. If you masturbate, slow everything down. Breathe deeply, relax your jaw and shoulders, and focus on sensation instead of outcome. You're teaching your nervous system that arousal is safe, steady, and controlled. This isn't about performance, it's about communication between your brain and body. Erections depend on relaxed blood vessels, not tension. When you slow down, blood flow improves naturally. Here's a question I often ask my patients: are you present with your body, or are you rushing to finish? That single shift in awareness can make a powerful difference. Presence restores sensitivity and responsiveness over time. Now, let's move gently into the second mistake, because this one affects the brain more than most people realize. Excessive visual stimulation, especially high-intensity content, can rewire arousal patterns. The brain is incredibly adaptable, but that adaptability cuts both ways. When arousal becomes dependent on constant novelty or extreme stimulation, everyday intimacy may not register as strongly. This doesn't mean attraction is gone. It means the brain has been overstimulated. I want to be very clear here. This is not about guilt or morality. It's about dopamine, the chemical of motivation and reward, becoming overloaded. When dopamine spikes too frequently, sensitivity decreases. Men often describe this as feeling numb or disconnected. Erections may still happen alone, but struggle during partnered moments. That gap is confusing and deeply frustrating. The solution isn't panic or shame. It's moderation and reset. Give your brain space to recalibrate by reducing visual overload. Many men notice improvements in arousal clarity within weeks. Try replacing screens with imagination or body awareness. This allows the brain to re-engage natural arousal pathways. Simpler stimulation often leads to stronger, more reliable erections. I've seen men regain confidence simply by changing this one habit. They stop fighting their bodies and start working with them. The relief on their faces is something I never forget. Now let's talk about the third mistake, because it's subtle and often misunderstood. Using masturbation primarily as stress relief can quietly backfire. When arousal becomes your main coping mechanism, your body associates stress with sexual response. Stress activates the sympathetic nervous system, which is the opposite of what erections need. Erections require relaxation, safety, and blood flow. Mixing stress and arousal confuses that signal. Many men don't realize they're carrying tension into intimate moments. Their minds are racing, their bodies are tight, and erections struggle to stay. This isn't failure, it's physiology. The fix starts with separating stress relief from sexual response. Build non-sexual ways to unwind, like walking, breathing exercises, stretching, or quiet time. This trains your body to relax without needing arousal. When sexual activity happens from a calm state, erections respond more naturally. You're allowing your parasympathetic system, the one responsible for arousal, to do its job. Calm creates confidence. I often tell men this: your body wants to work with you. It's not broken, and it's not betraying you. It's simply responding to the signals it's been given. Here's a quick pattern interrupt for you. If erections were purely mechanical, stress wouldn't matter, but we know it does. That tells us how powerful the mind-body connection really is. As we move through all three of these habits, notice a theme. Nothing here is extreme or irreversible. These are small, consistent shifts that retrain response over time. You don't need perfection, and you don't need fear. You need awareness, patience, and compassion for yourself. Healing doesn't come from pressure. It comes from understanding. If you're over 30, 40, or even 60, this still applies to you. Age changes the body, but habits shape function far more than most men realize. Improvement is possible at any stage. Let me reassure you of something important. Occasional erection changes happen to almost every man. They are signals, not sentences. When you respond early and gently, outcomes are often very positive. Ignoring the signs or panicking about them usually makes things worse. Calm action is powerful medicine. I encourage you to reflect honestly after this video. Which of these habits felt familiar? Awareness alone is the first step toward change. If you found value here, support your health by staying curious and informed. Ask questions, talk openly, and remember, you're not alone in this experience. Thousands of men are learning the same lessons right now. And before you go, let me ask you again. Have you ever noticed changes in your erections that made you wonder why? Share your thoughts in the comments, because your story may help someone else feel less alone today. Now let's keep going, because understanding the fix is just as important as recognizing the mistake. Once men realize their habits played a role, the next feeling is often fear. What if it's too late? I want to calm that thought right now. Your nervous system is adaptable at any age. I've seen men in their 50s and 60s retrain erections simply by changing how they respond to stimulation and stress. The body listens when you give it consistent, respectful signals. One powerful step many men overlook is rebuilding sensitivity, not intensity. Sensitivity is what allows erections to stay strong without forcing anything. Intensity, when overused, actually dulls response. Think of it like hearing music. If the volume is always maxed out, subtle notes disappear. When you lower the volume, clarity returns, and erections work the same way. This is why I often recommend periods of intentional restraint. Not punishment, not denial, but conscious choice. Giving your system a break allows receptors in the brain to reset. During this time, focus on sleep, hydration, and circulation. Erections depend on healthy blood flow, and blood flow depends on rest and movement. Even a daily 20-minute walk can make a noticeable difference. Here's something most men never hear. Morning erections are not just about testosterone. They're about nervous system balance. When sleep improves and stress lowers, those signals often return naturally. If you've noticed morning erections fading, don't panic. See it as feedback, not failure. Your body is telling you it needs better conditions, not more effort. Another powerful fix is reconnecting arousal with the body, not the screen. Touch without rushing, breathe deeply, and stay present. This retrains the brain to associate arousal with sensation instead of stimulation overload. At first, this may feel unfamiliar or even frustrating. That's normal. You're changing a pattern, and patterns resist change before they adapt. Let me share a brief moment from my practice. One patient told me, "I stopped chasing erections, and that's when they came back." That insight stayed with me because it's so often true. Erections respond best when they're invited, not demanded. Pressure tightens blood vessels, while relaxation opens them. This is biology, not psychology alone. You may also want to pay attention to how often guilt or anxiety enters your thoughts. Those emotions activate stress hormones that directly interfere with arousal. Compassion toward yourself is not optional, it's essential. If erections fail once, don't label yourself. One moment does not define your health. What matters is the overall trend, not a single experience. Consistency beats intensity every time. Small changes done daily rewire the system more effectively than extreme resets. Think weeks and months, not days. Nutrition also plays a quiet but important role. Foods that support circulation, like leafy greens, healthy fats, and adequate protein, support erectile health indirectly. You don't need supplements to start seeing improvement. Hydration matters more than most men think. Blood volume affects blood flow, and dehydration can subtly weaken erections. Something as simple as drinking more water can help. I also encourage men to stop constantly checking or testing themselves. Obsessive monitoring creates performance anxiety. Trust the process instead of interrogating your body. If you're in a relationship, open communication can reduce pressure dramatically. You don't need to explain everything, just enough to remove expectation. Connection often restores function faster than silence. And if you're single, this is still about future confidence. Building healthy habits now protects erectile function later. Prevention is always easier than repair. I want to emphasize something important before we close. Erectile dysfunction is not a personal failure. It's a signal, one that deserves understanding, not judgment. If changes persist despite healthy habits, talking to a qualified healthcare professional is a sign of strength, not weakness. Sometimes hormone levels, circulation, or medications play a role, and those deserve proper evaluation. But for many men, correcting these three mistakes creates noticeable improvement. Not overnight, but steadily. Confidence grows as trust in the body returns. So take a breath with me right now. You are not broken. You are learning how your body works, and that knowledge is power. If this message helped you see things differently, stay connected and keep learning. And once again, I invite you. What change are you willing to make first? Share it in the comments, because taking that step publicly often makes it real. When you respond early and gently, outcomes are often very positive. Ignoring the signs or panicking about them usually makes things worse. Calm action is powerful medicine. I encourage you to reflect honestly after this video. Which of these habits felt familiar? Awareness alone is the first step toward change. If you found value here, support your health by staying curious and informed. Ask questions, talk openly, and remember, you're not alone in this experience. Thousands of men are learning the same lessons right now. And before you go, let me ask you again, have you ever noticed changes in your erections that made you wonder why? Share your thoughts in the comments, because your story may help someone else feel less alone today.